Welcome to the We Level Up Treatment Center video series. In today's video we will discuss Intermittent Explosive Disorder, IED. Intermittent Explosive Disorder, IED, is a complex mental health condition that can have a profound impact on the lives of those affected. This video delves into the nature of IED, its symptoms, causes, diagnosis, treatment, and the importance of raising awareness about this often misunderstood disorder. IED is characterized by sudden, intense outbursts of impulsive, aggressive, and violent behavior. These outbursts often appear grossly out of proportion to the triggering events, and may manifest as road rage, domestic abuse, property damage, or temper tantrums. The consequences of IED can be far-reaching, impacting relationships, work, and even leading to legal troubles. Diagnosis and historical context. The diagnosis of IED has evolved over time. It is recognized in the Diagnostic and Statistical Manual, 5th edition, DSM-5, which distinguishes between more frequent episodes of verbal aggression and less frequent acts of destructive or assaultive behavior. IED is classified as a mental illness, a categorization that has evolved over time. The 3rd edition of the DSM was the first to refer to it as IED, prior to which it was considered a rare condition. With updated diagnostic criteria and research, it is now understood to be more common than initially believed. Symptoms of Intermittent Explosive Disorder. The symptoms of IED can take various forms. Low tolerance for frustration. Individuals with IED have a limited ability to handle difficult situations, often responding with a quick rush of anger as a coping mechanism. Intense anger. Intense anger is a hallmark of IED, leading to outbursts and aggression. Mood changes before outbursts. Individuals often experience significant mood swings leading up to an outburst. Blinding rage. Uncontrollable anger, leading to destructive or harmful actions, such as harming others or damaging property. Feeling out of control. IED sufferers may recognize a complete loss of control over their emotions and actions before and during an episode. Guilt. After an episode, individuals may experience intense feelings of shame and remorse, regardless of the episode's severity. Depression often co-occurs with IED. This can include persistent sadness, a loss of interest in everyday life and relationships, or even suicidal thoughts. It's important to note that not every individual with IED will experience depression, but it is a common co-occurring condition in many cases. Causes and risk factors. The causes of IED are complex, influenced by genetic, physical and environmental factors. While no single gene has been identified as the primary influencer, studies suggest that abnormalities in brain regions controlling arousal and inhibition may contribute to the disorder. Impulsive aggression in individuals with IED may be related to abnormal brain mechanisms that inhibit or prohibit muscular activity through serotonin. The environment in which a person is raised also plays a significant role. Childhood trauma, such as neglect, rejection, abuse, or abandonment, can be a contributing factor. Harsh physical punishment during childhood may lead to a sense of redemption through inflicting physical pain on others, as individuals may model their behavior after their parents' aggression. Risk factors for IED include being male, exposure to violence at an early age, exposure to explosive behaviors at home, such as angry outbursts from parents or siblings, having experienced physical or emotional trauma, a history of substance abuse, Certain medical conditions. Effects of intermittent explosive disorder. The impact of IED on individuals can vary depending on the severity of their symptoms and behaviors. The consequences of untreated IED may include impaired interpersonal relationships, domestic or child abuse, legal issues, addiction, difficulties at work, home or school, low self-esteem, self-harm, and even suicidal thoughts and behaviors. Treatment of IED. Fortunately, effective treatments exist for IED. While there is no one-size-fits-all approach, a combination of talk therapy, psychotherapy, and medication is often recommended. Seeking professional help is crucial for individuals with IED, as it can lead to significant improvements in their ability to manage and control their symptoms. IED disorder therapy. Seeing a counselor, psychologist, or therapist alone or in a group setting may help a person manage symptoms of IED. Cognitive behavioral therapy, CBT, involves identifying harmful patterns, coping skills, relaxation techniques, and relapse education to deal with aggressive impulses. Cognitive behavior therapy, CBT, is a psychotherapeutic IED therapy that helps individuals understand the thoughts and feelings that influence behaviors. CBT for intermittent explosive disorder is commonly used to treat many disorders, including phobias, addiction, depression, and anxiety. IED disorder medication for explosive anger. There aren't any treatments for IED disorder that specifically treat explosive anger. However, some medicines may help curb impulsive conduct or aggressiveness. These consist of antidepressants, in particular, selective serotonin reuptake inhibitors, SSRIs, mood stabilizers, including lithium, valproic acid, and carbamazepine, antipsychotic drugs and anti-anxiety drugs. IED disorder alternative treatments. Few studies have explored the effectiveness of alternative treatments and lifestyle changes for IED behavior. Some of these include adopting a balanced diet, trying alternative therapies, such as acupressure, acupuncture, or massage, practicing meditation or other mindfulness techniques, avoiding alcohol, drugs, and cigarettes, reducing and managing sources of stress, making time for relaxing activities, such as listening to music, getting enough sleep, staying physically active. Intermittent explosive disorder is a complex and challenging condition, but it is not insurmountable. With the right diagnosis, treatment, and support, individuals with IED can find ways to manage their symptoms and lead fulfilling lives. Increased awareness and understanding of this condition are crucial to providing effective help and support to those who need it. Understanding IED is the first step toward a more compassionate and supportive society for individuals living with this condition. By sharing knowledge about IED, we can reduce the stigma surrounding it and ensure that those affected receive the care and support they deserve. Raising awareness about IED is not only about understanding the condition but also about creating a more inclusive and empathetic world. With knowledge and support, individuals with IED can embark on a journey of healing and recovery. At We Level Up Florida Treatment Center, individuals battling intermittent explosive disorder are met with personalized treatment plans that use medical expertise, counseling, and holistic practices to foster positive change. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.